X-rays are a form of electromagnetic radiation that is commonly used in medical imaging to visualize the internal structures of the body. They were first discovered in 1895 by German physicist Wilhelm Conrad Roentgen, who was awarded the Nobel Prize in Physics in 1901 for his work. X-rays are a type of ionizing radiation, meaning that they have enough energy to remove electrons from atoms and molecules. This makes them potentially harmful to living tissue, which is why precautions must be taken when using them for medical purposes. In medical imaging, X-rays are generated by a machine called an X-ray tube. This tube contains a cathode and an anode, which are connected to a high-voltage power supply. When a high voltage is applied across the tube, electrons are emitted from the cathode and accelerated towards the anode. When these high-speed electrons collide with the anode, X-rays are produced. X-rays are able to penetrate through the body because they have a shorter wavelength than visible light. When an X-ray beam passes through the body, some of the X-rays are absorbed by the tissues, while others pass through and reach a detector on the other side of the body. The resulting image shows the relative density of the different tissues in the body, with bone appearing white and air-filled spaces appearing black. There are a number of different types of X-ray imaging techniques, each of which has its own advantages and disadvantages. These include conventional X-rays. This is the most common type of X-ray imaging, and is used to visualize bones and other structures that have a high-density contrast with the surrounding tissues. Conventional X-rays are quick, easy, and relatively inexpensive, but they are not very sensitive to soft tissues and cannot provide detailed 3D images. Computed tomography, CT. This imaging technique uses a series of X-ray images taken from different angles to construct a detailed 3D image of the body. CT scans are more sensitive to soft tissues than conventional X-rays, and are often used to visualize internal organs and detect abnormalities such as tumors. Fluoroscopy. This technique uses X-rays to visualize real-time images of the body as it is in motion, such as the movement of the digestive tract or blood flow through the heart. Fluoroscopy is often used in surgical procedures and to guide the placement of medical devices. While X-rays are an important tool in medical imaging, they are not without risks. Exposure to high levels of ionizing radiation can increase the risk of cancer and other health problems, which is why X-ray technicians and medical professionals take precautions to limit the dose of radiation that patients are exposed to. Patients can also reduce their risk by informing their doctor or technician of any previous X-ray procedures and asking about the need for the procedure, the expected benefits, and any risks involved. In conclusion, X-rays have revolutionized the field of medical imaging, allowing doctors to see inside the body without invasive procedures. However, it is important to use X-rays judiciously and take precautions to minimize the risks associated with ionizing radiation.